I'm Dr. Tejal Gandhi, Chief Safety and Transformation Officer at Press Ganey, and I'm going to be talking about the intersections of safety, equity, and trust during the COVID-19 crisis. In safety, we've really been thinking about a broader definition of harm. And this was before the COVID crisis actually occurred. We'd been talking broader definitions of harm that included physical safety as well as psychological or emotional safety, that included harm to patients as well as harm to the workforce, and that included harm across the entire continuum of care. So, really shifting safety from inpatient focused physical harm to this much broader definition of harm that I just described. And one thing, as we've been thinking about the physical and emotional harm piece, is that we've also been thinking about really making sure that we're including inequity as a type of harm. You cannot have safe care if care is inequitable. You cannot have high quality care if care is inequitable. And inequity can lead to physical as well as emotional harm and can lead to harm to both patients and the workforce, and certainly occurs across the entire continuum of care. So, as we think about that in COVID, we have seen many examples of physical harm to patients and the inequities that have been present in the physical harm and in the emotional harm, things like the social distancing when patients are in the hospital and inability to have visitors, and those kinds of things have certainly led to emotional harm. And in those physical and emotional harms that we've been seeing to patients, there's been large inequities in rates of infection, hospitalization, and mortality in the United States. Globally, even, we're seeing increased risk and impact on poor, underserved populations. And that harm is both medical harm, physical, emotional, and also financial harm. One statistic from the global standpoint is that for each percentage point reduction in the global economy, more than 10 million people are plunged into poverty worldwide, just talking about the inequities around financial harm that may be occurring or that are really occurring. So then you think about harm as well to caregivers. There's been lack of PPE, increased infection rates, and those have also had inequities in terms of availability to PPE, the fact that some essential workers in healthcare and outside of healthcare um, have needed to continue to working despite the risk, and thinking about the entire continuum of care. Those harms to caregivers have occurred not just in hospital settings, but particularly even in settings across the continuum, like nursing homes, uh, in the home itself with home health aides, et cetera, where again, PPE availability has been really lacking. So, as we think about safety and equity, we need to really think about inequity as a systems based problem that requires a systems based approach, just like we've taken with patient safety over the years. What we've learned in patient safety over the past 20 years can really advance equity and trust. We've talked about designing systems to make them more reliable and resilient. We've talked about the need for psychological safety to have conversations about these topics, the balance between system and individual accountability, the need to understand cognitive bias and often unconscious biases that may be occurring, and avoiding excess focus on blame and shame. Those concepts in safety can certainly help us as we start thinking about how do we narrow some of the gaps in equity. We can also leverage safety infrastructure that already exists. So, thinking about root cause analysis or safety reporting or safety culture, and those things that we've been working on in safety for the past 20 years can certainly be leveraged to have more of an equity lens within them. And then, really importantly, we need to stratify data. By stratifying data, we've seen some of the inequities in the COVID pandemic. And when we move forward, we need to continue to stratify data around equity, around safety, around quality to make sure that we are identifying those issues. Data stratification has to become the norm. And we need to make sure that we are understanding unintended consequences that can be occurring. Often, our systems, redesign, our technologies, etc., we focus on standardization and that's generally been a good thing, but we have to make sure we are measuring to make sure we're not creating unintended consequences and potentially widening the inequity gap with some of these interventions that we are putting in place. So that unintended consequence piece is really critical. Lastly, when we think about trust, there's a framework that was in a Harvard Business Review case that talked about three foundations of trust. It's a Harvard Business Review article, actually, by Francis Fry, and it talks about three dimensions of trust. That means authenticity, empathy, and logic, and that leaders need to bring authenticity, empathy, and logic to what they're doing to establish trust. And I think that those three concepts are something we could certainly explore when we get together to think about how have leaders brought authenticity, empathy, and trust to authenticity, empathy, and logic to building trust around safety, and how can leaders continue to bring authenticity, empathy, and logic as we think about narrowing some of these inequities? So I'll look forward to talking to many of you at our meeting. Thanks very much.